Good afternoon. My name is John Hosel, and I'm here to give a presentation for technical reporting on how to perform a venipuncture. So, what is phlebotomy anyway? Phlebotomy is considered the quote unquote art of drawing blood, and it's used in medicine all the time, especially in the diagnosis of many diseases such as diabetes or rheumatoid arthritis. Low vitamin D levels are diagnosed through drawing blood and testing it. Also, doctors draw blood on patients undergoing treatment for various diseases to make sure that the liver and the kidneys are still functioning well on the medication and that there isn't any lingering effects of the medication on the body. So, what do you need to do a typical blood draw? Um, with every blood draw, you're always going to need a pair of gloves, a tourniquet. Generally speaking, a 21 gauge needle will draw 95% of most patients. There's always a few patients with smaller than average veins, and you may want to choose a smaller needle for that. And that you treat that as a case by case basis. You always want to gather up the appropriate blood tubes for the tests that the doctor's ordered. That's very important because each tube has different additives and can affect blood tests differently depending on what they're drawn for. You need an alcohol wipe or some sort of cleansing agent for the patient's arm or hand or wherever you're going to be drawing blood from. A piece of clean gauze and a bandage to clean up the patient after the blood draw. Generally, for the procedure, you want to start off by introducing yourself to the patient, get settled in, get all of your equipment ready, so that way you can inspect for a good site to make your blood draw. Then the next step is to simply perform the venipuncture. And then once you're done, get the tubes labeled appropriately and bandage the patient and get him or her on their way. So the first step, introduce yourself. This is, in my opinion, one of the most important steps that you can take when going to draw a patient's blood. The patient sees you for the very first time when you enter the room to draw blood. This is your first chance to make a good impression, and your confidence level can be perceived pretty readily by the patient in terms of body language and how you carry yourself. So, if you're nervous about drawing blood, you should try your best not to show it in front of the patient because they'll get a little anxious about someone who they perceive to not be that skilled to be drawing their blood. You want to speak confidently and honestly with the patient. You don't want to trick them or say it's not going to hurt or anything like that. You want to be completely honest, but put them at ease. Tell them it's a quick procedure as long as everything goes correctly and the patient stays nice and still, and usually is not a problem for most patients. All right, now that the introductions are out of the way and you're ready to go draw blood, now what? So the area of focus for most 99% of veins that you would want to draw blood from is the antecubital region, which is the area on the opposite side of your elbow when you open your arm out with your palm facing up. It's that patch of skin right above that area. And that's where most of your really good arm veins are, or at least cross in that area. So before you start searching that region, you want to wash and sanitize your hands and put on a fresh pair of gloves. When you apply the tourniquet, you want to make sure it's at least 2 inches above the antecubital region, usually right on the bicep muscle. That's the word I was looking for, bicep muscle. You want to tie the tourniquet around that area and have the patient make a fist, which will kind of raise up those veins and make them a little easier to find. And next you want to palpate with your index and your middle fingers across the antecubital region. You just kind of want to gently press down, and you're feeling for sort of a bounce back effect. When you find a vein, you'll find that it's really bouncy. It kind of feels almost like a like pushing your fingers down on a small garden hose. You can kind of feel the pressure there and it kind of springs right back up when you let your fingers go. That's how you know you found a really good vein. Once you found that vein, you want to palpate up and down from the spot that you found it so you can kind of get a line for how the vein is lined up in the patient's arm because it will be different for everyone. And once you've got that line and you've got a landmark with which to tell where the vein is, you want to start cleansing the region for the blood draw. And once you start cleansing, you don't want to touch the area again until you're ready for the actual blood draw. Now, like I was saying, once you found that vein, you want to cleanse it with that alcohol wipe. You start with a circular motion right where you're going to make your venipuncture, and then you want to circle clockwise, counterclockwise, whatever suits your fancy, away from that site, about 2 inches in diameter away. And you don't want to go back towards the center because you just cleaned that area. You want to keep it nice and moist and just work your way out and then let it air dry. The effect of air drying is what actually kills the bacteria on the patient's skin, not the alcohol itself. So it's important to let it dry before you proceed with the venipuncture. Now you take the needle that you selected and attach it to the adapter and select those blood tubes for your test and put them in the correct order that you need for your test. We'll see on the next slide what the correct order of draw is. And when you position the needle, you want to make sure you want to keep it at a 30-degree angle, pointing in that line that you found that the vein was lying in. You want to keep it nice and parallel with that, but right on top. Right before you proceed with the venipuncture, you want to inform the patient that there's going to be a stick. Generally, when I do it, I'll say 1, 2, 3, and then I'll go right for it. And you want to do a nice smooth motion. You don't want to go super slow because that increases the pain for the patient, but you don't want to go so fast as to miss the vein entirely and end up hurting the patient in a different way. Now that order of draw. The order of draw is so important for these tests, mainly because of the additives that are in these tubes, and sometimes cross-contamination, though rare, can occur between these tubes, which is why you want to go in the correct order so you don't accidentally get additive from one tube added to a tube that is inappropriate for it, because it will cause false results and then you'll have to draw the patient again, which generally doesn't make the patient very happy. So usually the order of the draw starts with the light blue top tube, should you need that tube for your test. That one's usually done for coagulation therapy, patients who are on warfarin or heparin. Red top tubes are pretty standard and kind of the run-of-the-mill catch-all for most tests. That's usually the one you end up drawing first unless the patient is a coagulation therapy patient. And then you go through the other orange colored tubes that are for specific tests as listed in the chart. Then the green top, which is sodium heparin, that's usually used to run a complete metabolic panel, check your sodium and your potassium and your electrolytes and kidney and liver function generally. Your lavender top, generally for blood counts, also for blood bank, if you're going to be donating or receiving a transfer of blood, you'll usually have a lavender top drawn in that case. And then you have your royal blue top, which usually is for heavy metals, and gray tops, which are for blood alcohol levels, and those are usually drawn by police officers out in the field when they have a intoxicated driver or something like that. It's important to release the tourniquet before you remove the needle. If you fail to do that, you're going to have a fountain of blood coming out from the venipuncture site because the tourniquet's still applying pressure to the vein and causing it to be a pipe under pressure, essentially. So release that tourniquet and then remove the needle. And as soon as you remove that needle, you want to apply the gauze pad right away and have the patient start putting pressure on that gauze pad to get the bleeding to stop. While the patient's helping you out with that, you can start labeling the tubes of blood that you collected for the test, making sure you got the patient name correctly and all the other pertinent information. Once you get the tubes labeled and the patient's put pressure for a little bit, you want to apply a bandage over that gauze pad to help deliver some more pressure to the wound. Most patients can take that all off 20 minutes after their blood draw. If, for example, they've been on Coumadin or heparin therapy and they had a light blue top drawn that day, then you want to make sure that patient takes a little extra time of keeping that bandage on past the 20-minute interval just to give them enough time for their blood to clot in that area so that way they don't start bleeding again after they leave the office. So in conclusion, this presentation just gives you a basic phlebotomy overview. The techniques used here are tried and true and will work for, about 85–90% of most patients. There's always going to be variability in this field, and there's always going to be different sites that you can choose besides the antecubital region mentioned in this one. For example, some patients have to be drawn from the hand because you can't find any good veins in the antecubital region. Some patients, especially paraplegics, most of their good veins are in their feet. And so you end up having to draw blood from their foot, which is not recommended for the standard phlebotomist. If you're ever in a situation where you have to draw blood from a site that you're not familiar with, you should make sure you have the doctor's permission before you attempt to draw from that site, or bring in a seasoned phlebotomist that has done that site to supervise and make sure you're doing the techniques appropriately. This concludes the presentation. Thank you for your time and have a great day.